As of yesterday, my inmate count was 19,402. Total number so far for this year is 59. 59 deaths total for 2018 presently. We report our deaths as required to the Department of Justice and the State Medical Examiner's Office. Those are the only two entities that we're required to report our deaths. But in an era of transparency for the month of August, we had deaths kind of back to back, and so we reported those deaths, and so it kind of deviated from our protocol. And when we did that in an era of transparency, Department of Corrections became on the radar for having a large number of deaths. However, there was nothing sinister particularly about those deaths. It was just that it was now on the radar from the media standpoint. So we continued to report those deaths as they happened, and I think it was misinterpreted as to the causes for those deaths. And, many of those, like I've said in my statement before, were from natural causes. We see more and more that people come into our correctional system, from chronic illnesses, illnesses that have never been treated or illnesses that have never been diagnosed. And they come into our system, having those conditions that require extensive medical treatment. And so with the reported deaths that we had in the month of August, 16 that were reported for the month of August, 13 of those we've been able to determine from provisional autopsies that were made available to us, as well as our own internal investigative reports that we had that were able to tell us that those 13 were from natural causes. We do have 2 that are yet to be determined that we're waiting on final autopsies on, and we do believe that one was a homicide. And so for all of those deaths, again, we're not trying to hide anything. We want to be as open and honest as we can, but also accurate at the same time in reporting that information. So out of deference to the deceased and the families of those deceased, we think it is important that we always give out accurate information and give them an opportunity to mourn the deaths of their loved ones, and not have it to be sensationalized in the media about, my particular loved one died for any particular cause. So we've not identified, John Doe cancer or whatever, but we know that many of those deaths were the results of cancer-related deaths, renal failure, cardiovascular disease, complications from diabetes, things like that, that whether you're in corrections or not, or incarcerated or not, someone could die from. And that's what we've seen. But we always are trying to be transparent in how we report our information for the most part. So we tell what we can at the time. So all of the deaths that we've reported, we're waiting on final autopsies on, but we did have enough information available to us to be able to make that preliminary determination. My PIO normally sometimes will put out a press release as it relates to those deaths, or they might be reported on our website. We're always looking at our protocol or our processes about how we relate information to the public and determining what's the best practice. So, as we were looking at reporting of inmate deaths, we've reached out to colleagues across the country to determine how other departments of corrections handle their inmate reports for inmate deaths. And so, we might change our protocol about how we do that, but currently the information was being reported on our website or through press release to the media. The autopsies are not subject to public disclosure under the law, under the Public Records Act, so it would not be readily made available. Now, the families can always communicate with the coroner's office to get that information, and they would have, they could request an autopsy through the coroner's office, I believe, to get that information. And the message that I want to send is that it is always concerning to me whenever we have a death of someone in our custody, whether it be from, an act of violence, whether it be natural causes or the like. So to think that the commissioner sitting here is not concerned or is turning somewhat of a blind eye to what's going on, that would be incorrect. So just like the governor said it's concerning to him, the lieutenant governor said it's concerning to him, it's concerning to me as well. But that concern does not mean that there's some ill intent or some sinister actions going on that cause these deaths. It's just that anytime a life is lost in my system, I'm always concerned about it. So we're always evaluating, looking at our own internal processes to see if there's something that we could do better. Not particularly that anything was done wrong, but we always are going to review. And so, again, bringing some validity to the process, we reached out to the FBI and to MBI to take a look at these series of deaths for us. And I think when the information was put out, it immediately alarmed people to say, oh, it's so bad, now they had to call in the FBI. And that's not the case. The Department of Corrections works hand in hand with the FBI all the time. They investigate our civil rights violations for us, or allegations of civil rights violations. So my department, my investigative department, has a really good working relationship with the FBI, and we call them in routinely. So there was nothing, out of sorts for me to say that I was calling in the FBI, because we do it all the time. They're still working with my staff. My investigative team would provide our internal investigative reports to them, or whatever the file might entail, to them, and then they would come in and do their own investigation. So that process is underway now. Not particularly directly. My deputy commissioner did have a conversation with one family member, and it was actually a natural cause death. And I think more so, the family was a little upset that they weren't able to get to the person to visit before they actually expired. The timing of a last minute visit, I think that's probably what their major concern was, but they did understand that it was a natural cause death. And so, having conversations with each and every one of the family members, we have not done that. I've seen a lot of, social media feed about, allegations that, Department of Corrections is allowing these people to die, or is causing these people to die. And it's just incorrect. It's a misrepresentation of the facts. It's a misrepresentation of how we run our system. I'm an attorney, and I sit in this seat, and I don't take off my attorney hat. So to think that I would check my morals or my ethics at the door to sit in this seat as a commissioner, absolutely not. And so if there's anyone who ever works in my system, whether it be a correctional officer, deputy commissioner, investigator, or medical professional, that didn't do their job and that caused someone harm, we would investigate that and handle it in the most appropriate way. So accountability first and foremost for people who sit in these positions of public service. All of our correctional officers, when they're hired, go through a training academy. It's an 8-week training academy where they have six weeks of in-class training and 2 weeks on-the-job training. And as part of that training, they're taught techniques to deal with inmate violence, to deal with altercations in the system, where they apply certain defensive tactics. Unlike law enforcement officers on the street, my correctional officers are not armed with a weapon. They have mace, if you will, that they carry with them. OC spray is what we call it. They have OC spray that they carry with them, and they might have a radio that they carry with them. But as far as any defensive, mechanisms to protect themselves, they don't really have that. And so they are in harm's way every day. So a lot of times, to get in the middle or break up a fight from from one correctional officer standpoint, that's just really not plausible, because the threat of harm to them is greater than that to the inmate themselves. So it would require, basically, if they see something like that going on, what we call a 1017, and that is a call for assistance emergency situation, where other correctional officers would come in and assist, whether it be a emergency response team, a K9 team that would come in to break up the instance of violence. But what we're seeing in our system right now is that, we are understaffed. And, I'm not going to hide that. I think they've heard it in the public that the Department of Corrections is understaffed. And so the ability to be able to come in and break up those instances of violence, are greatly diminished by the level of staff that we have. And so, we're doing everything that we can to basically try to address that. We've looked at possibly revamping our training academy to lessen the time from the 8 weeks to possibly go back to 4 weeks, to be able to fill the void that we have in our system right now, but not taking a focus off of the training aspect as far as protection from harm, being able to address emergent situations, people dealing with medical issues. How do you respond to that? They're all taught CPR and medical first aid, so they know how to respond in case there is a need for someone who's in distress, how to respond. And as much as I like to sit here and say we're never going to have an act of violence in our system, that we're never going to have someone to turn a blind eye when they see someone who needs assistance, that's not going to happen. But when it does happen, we're going to address it. And I think that's the most appropriate thing. How did you respond when that adverse situation came about? How did you respond when that correctional officer didn't do the right thing? And so this administration has a zero tolerance policy. And I say it's not only for the people incarcerated in our system, but for the people who work for me too. So for those who are not willing to follow the policy and procedure and are willing to break the law, you're no longer going to be a part of this department. And so I found many of those under my watch, and it's unfortunate. My deputy commissioner of institutions calls them crooks in blue. We all have them. It doesn't matter what department you have. And for those crooks in blue, they traded their uniforms in for a jumpsuit. There's nothing out of sorts here when it comes to the number of deaths that we've had in our system. We are on track to basically be consistent with what happened in 2017. I would love for no one else to expire or pass away under my watch, but that's just not reasonable. That's just not even rational for me to sit here and say that. People are going to pass away. That's the circle of life, as you will. But the thing about it is, as long as we're addressing the needs of the individuals in our custody, their medical needs, then I would say that we've done our job. It is unfortunate that we do have sicker people in our population. A lot of times the Department of Corrections is the gap filler for a lot of things that have gone unaddressed, right? People who have a history of alcohol and drug abuse, and they come in our system and they're not really well. They haven't been well taken care of. People who have never really been consistent with medical treatment and medical appointments. People who have never had their mental health needs addressed. All of those things come into the Department of Corrections. And we're supposed to be able to deliver those services for individuals in our custody and do it perfectly. And again, that's just not rational thinking that, if I have someone who has terminal cancer, they're going to die. And that's just unfortunate. My father passed away from cancer, and he was not incarcerated. And so again, that's just something that is going to happen, and I have empathy for the families of the individuals that passed away. But again, it wasn't because the Department of Corrections did something wrong. We're going to always make sure we're going to deliver those constitutional needs to the people in our custody, and medical care is one of those. The department spends about $50 million on contracted medical care with our provider, and that doesn't even encompass the specialty care that's required. So a huge amount of resources are spent for taking care of offenders in our custody, and we're going to continue to work and improve our practices as much as we can. But again, we're not trying to hide anything, and we'll be as open as we can, be responsive as we can, in taking care of the needs of those in our custody.